Hello dear patients and now followers. I'm Dr. Ahmedov. I'm one of the hair transplant surgeons at my hair clinic. Today I would like to share with you an interesting case. We all know that one of the most common aesthetic procedures the male population have nowadays is the hair transplantation. But there's also like a high demand for the beard transplantation from the patients. And every once in a while in our practice, we see the request from the patients if we can do a combined surgery of beard and the hair transplantation. Of course, depending on the hair loss degree, the hair transplantation can be combined with the beard transplantation surgery. But as mentioned before, it depends on what's the extent or like how far the hair loss has proceeded, or on North Hamilton scale, what's the degree of the hair loss. Today we will have a 29-year-old patient who was admitted to our clinic 1 year ago for the combined hair transplantation surgery and beard transplantation surgery. Here on the pictures we can see the patient from the front side. We can see that he has the neurotype 2 to neurotype 3 of the hair loss. What does it mean? First of all, it means the loss of the continuity of the front hairline, receding on the right and the left temples, and maybe some thinning in the front forelock and slightly to the front third, depending on the degree of the hair loss. For this type of patients, for the early stage of the hair loss, when the patient is on neurotype 2 to neurotype 3, we may require the numbers something between 1,500, 1,800 up to 2,500 grafts. In some patients up to the 3,000 grafts. It depends on the size of the open area, the density one required, patient's expectations of course, and how much we change the hairline. We are not very keen on changing the hairline specifically for the young patients, because we always tell them, hey, it's better to keep the hairline really conservative, higher and slightly narrow in the corner, so we can give the patient more coverage in the density. And also the hairline is age relevant. As we men get older, the hairline may recede naturally, so we need to keep it up at the level, so if even like 5, 10, 15, 20 years later, the hairline will be actual. So the patient was admitted, as I have mentioned before, for the combined hair transplantation and beard transplantation surgery. For the hairline, we planned a conservative hairline that was settled pretty high and very simple. You can see it from the pictures. We kept the shadow or the remnants of his own hairline, rebuilt it and reinforced it, and mainly tried to restore the front hairline, cover the front line, and reinforce the front forelock a little bit. The total size of the area that needed to be transplanted was 45 to 50 centimeters squares in total. So for more or less good density, we need at least 40 to 50 grafts per centimeter square. So the average number of the grafts of this patient to cover this front part would be something around 1,800 to 2,250 grafts. And the second request of the patient was the beard transplantation. He had some beard that specifically on the cheek area and the jawline portions of the beard, it lacked the density and volume. Actually, you can see it here from the side. Yes, there are some like remnants of the beard, but it's not continuous. There are some like islands of the patchy hair across this line, and the cheek area is almost completely open. The left side and the right side are slightly different. We decided to keep the same shape of the beard the patient had, and some point-like hair that he had got on himself. So here we can see the beard design on the right cheek. So we tried to, the plan was to rebuild the sideburns, the jawline, and the cheek region. Also, the same was for the left side of the face as well. Rebuild the sideburns, cheek, and the jawline. And also one of the points, the major points for the beard transplantation, is when we need to reinforce or add up a little bit of the hair to the tuft of the hair to this goatee line. It gives a very natural pattern to the beard. So the plan was also to build this one as well. And so this is the final drawing. You can see we tried to keep his oven, go through the remnants of his oven beard line, link it up to the angle of the lips or the mouth, and rebuild the front small goatee as well. We explained to the patient that yes, it's a combined surgery. Every once in a while, for some patients, you may require the second surgery for some densification. So actually, the plan was a two-step surgery. With the first surgery, we rebuild the front hairline, fill up the gaps in the front area, and then the rest of the number is evenly spread on the right and the left cheek to fill up the beard. The idea was not to give him a super high density. No, the idea is to give him the density of the beard, or like some good shade of the beard, and get it close to what he has for his like beard, goatee part, and mustache. The density close to this one, because himself, he doesn't have a really high density. So when you want to make this area super dense and it won't match the density of his own one, it may look really weird. So it's very important for us to keep it in equilibrium. So the density should not exceed what he has and should not be lower as well. So the idea was to give a good shade of the beard, and if needed, the patient was like consulted and advised to that he may have the second surgery. But what we see in our practice is that even for the patients who have no beard or very like low density beard, even the smallest change makes them really happy. So the second surgery is most of the time is on demand, depending on the patient's expectations. So we planned for the mega session, we were planning to extract at least the number between 3,600 to 4,200 grafts. So it's a mega session, and we did the extraction from the patient. The number of the grafts was 4,000 grafts we extracted. After the extraction of the grafts, the first thing we did the rebuild of the front hairline, filled up the gaps in the front side, and 1,900 incisions and grafts were implanted to the front hairline and the corners, the transition, or as we call it, the frontotemporal angle. And we can see it from the picture when the area is covered. So I always tell my patients that the high or like conservative hairlines are very simple, very beautiful, and they stay actual for the long time, even all the time, because the hairline has, as I told you before, a tendency or age relevant tendency. So we can see here the rebuild the hairline, filled up the gaps between the transition of the front to the temples. So 1,900 grafts were used for the hairline and the front side of the hair. And after that, we went with the beard. As we've mentioned, we kept his own beard line, rebuilt it, and the idea was to give him a good shade. 1,150 incisions were made to the left side of the cheek and 950 were made to the right side, because there was a difference between the density and the coverage on the right and the left cheek. So here you can see the right side coverage with 950 grafts and the left side with 1,050 grafts. By the way, inside this number, we also have around 55 to 60 grafts implanted to the front goatee. So this transition from this front side to this main beard becomes more natural. Now I would like to share with you a 1-year result of the patient after the combined hair and beard transplantation surgery. This is the picture of the patient from the front side. You can see the front hairline is rebuilt. Yes, it's not a high density, but the patient may require one more surgery to increase density a little bit. But most of the time, the patients become really happy even with this result, because we have restored the front frame of the face, and there is a very sharp demarcation line between the forehead and the skin of the head. The main reason is that they lack the demarcation line or the separation line from the forehead to the skin of the head. So there is direct transition. So we have rebuilt this border, and you can see the beard, his over natural goatee side, his natural mustache side. The density is very close to each other. That was the aim for the surgery, to get the density close to what he has, not to give him a super high density that will look really unnatural. Here is the left side of the cheek, the sideburns rebuild and transition to the side. And also in this picture, you can see that we have rebuilt this transition a little bit as well. So just to give him a more natural look. And you can see the hairline here from the upper side. It's very natural. It looks like a really light receding hairline, looks very natural. It's like a thinner hair at the beginning and thicker to the back. That's how the natural hair transplantation should look. As a summary, yes, combined surgeries can be done every once in a while for the patients who require hair and beard transplantation, or sometimes it can be hair and eyebrow transplantation, or even in some patients eyebrow and beard transplantation. The decision for the surgery is taken individually depending on the extent of the hair loss on the hair first of all, the request for the beard, so the sizes, the extent of the hair loss or the beard problems are evaluated individually and decided. But major answer, yes, the combined surgeries are possible. Point number 2, you cannot do it for everything because again, we hugely depend on the number of the grafts you'll be able to get from the donor area. Hope it helped you and gave you some idea regarding the combined surgeries. Stay tuned and follow us on Instagram and YouTube. Good luck.